Well, I'm Dr. HenryTseng. I'm a glaucoma specialist here at the Eye Center. Glaucoma is very unique in the sense that our patients tend to be very complex. They are not in just for a glasses check. Usually they have years and years of history. They may actually come from other doctors. And so the first step we usually do is trying to get to know the patient, not just eye problems, but all the other medical issues and everything that's been going on for the last few years, if not sometimes decades. And that sometimes may take multiple visits. And we have to get old records from other prior doctors' offices and things like that. And then of course, then we have to do all the testing that goes with it. So our approach is take the patient as a whole and get to know them as well as we can and learn as much as we can through the history, but also through testing and examination, and then come up with a treatment plan for the patient and explain all that to them. Glaucoma is a field where there's a lot we don't know about, and there's a lot of potential ideas. But the one idea that we're working with is the fact that glaucoma it may actually be a neurodegenerative disease, kind of like Alzheimer's and Parkinson's, Huntington's, these brain diseases that we typically think of. And it's a really exciting change of how we think about glaucomas. And actually one of the genes I'm studying in glaucoma has been linked to Lou Gehrig's disease. So you have one gene that's involved in two diseases of the brain and the eye, and hopefully we can find some connections that will give us a clue to what may be causing problems in either of these diseases. And potentially treatments we develop for one may be good and useful for the other. I've always loved science, I've always loved research, but being a physician, especially a physician and a scientist, allows me to work at the science part, the research part, and then use it to help patients to make an impact. So it's not just neat science, but it's actually applicable, and you can actually make a difference in somebody's lives. And so that's, I think, initially what motivated me to go into medicine, and especially in ophthalmology, where through medicines and surgeries, we could directly make an immediate impact, taking someone from being almost blind to 20/20 vision the next day, especially with cataract surgery. And that is very satisfying, very, one of the motivations of why I became an ophthalmologist.